Okay, so we just have a couple of drugs to go over to treat the symptom of diarrhea. The first one we'll talk about is diphenoxylate or Lomotil. Specifically, we're using this drug to treat mild to moderate but acute diarrhea. And so remember from earlier we had talked about several opioids. The main side effect to some of these drugs is constipation. And so what better way to treat diarrhea than to produce constipation? So what we've done is we've taken an opioid type molecule, which is related to meperidine, which we'll talk about much later in the curriculum, and we've formulated it so that we can give it orally, and it'll act primarily on the enteric neurons, specifically looking at some of the mu receptors, which we'll talk about in the CNS brain behavior block. But essentially what we're going to do is we're going to have a twofold mechanism. We're going to increase the muscle tone of the intestines, and we're also going to enhance some of the segmental contractions along the GI tract to kind of break up these boli that are forming. So you may consider, well, if we've got a drug that is opioid in chemical nature, is there any type of abuse potential? And we've thought about that. What we've done is we've also formulated this particular drug with a very small amount of atropine, which we haven't really talked about. But let me just tell you that if you do take atropine orally, it is really unpleasant, and patients will really not abuse Lomotil. Doesn't mean they don't try to, because they do their homework and their chemistry, but it's really going to be really hard to abuse this drug because it's so unpleasant because of the atropine. Now, if the patient does take a whole bunch of Lomotil tablets or capsules quickly, some of these high doses can have CNS effects. Atropine also will by itself produce some anti-diarrheal effects as well, which we'll learn about again much later in the curriculum. I should point out that diphenoxylate is prescription only. The other two drugs that we'll talk about are over the counter. So I'm sure you've all taken at some point loperamide. You may recognize it under the brand name Imodium. This is a mu opioid receptor agonist, and it doesn't cross the blood-brain barrier. Okay, it stays within the periphery. It's related actually to the antipsychotic haloperidol, but it has really no analgesic effects. And as I said before, it's non-prescription or over-the-counter. We're going to look at the enteric neurons, which basically signal through those mu opioid receptors. And what we essentially do is we increase the transit time through the intestines. And so this is a good way to kind of stop diarrhea. This would be the drug that you'd kind of be your go-to drug for traveler's diarrhea, especially if you're traveling overseas. And then, of course, the third drug is bismuth subsalicylate, or Pepto-Bismol. This is an interesting drug. It has a whole host of anti-motility, anti-secretory, and anti-inflammatory type of effects. The bismuth portion may even be antibacterial, and it's been shown to have some bactericidal activity against the enterotoxigenic strains of E. coli that are primarily responsible for traveler's diarrhea. This drug, which is available in liquid form, which is shown here, does produce a discoloration of the stool because it's pink in nature. With chronic use, this drug is shown to produce tinnitus or ringing in the air. And of course, it is contraindicated for young children because of Ray's syndrome. And of course, it is a salicylate in chemistry nature, much like aspirin. So those are the main drugs for treating diarrhea, and we will continue with other drugs shortly.